Good afternoon. My name is Fariborz Pakseresht, Director of Oregon Department of Human Services. Today, we want to share with you what Oregon Department of Human Services and Oregon Health Authority are doing together to keep our residents in long-term care facilities across Oregon safe. In DHS, our goal and our passion and our work is to assist people who need our services. People, especially in congregate care settings such as nursing homes, are especially susceptible to a rapid spread of the virus, and they've been on the top of our priority since this pandemic began. DHS regulates about 670 nursing facilities, assisted living facilities, residential care facilities, with about 30,000 residents. Another 1,500 additional adult foster homes have maximum of 5 residents in each of those homes. Our aim has been to try to stay a step ahead of this virus from the very beginning. As soon as the first COVID-19 case was confirmed in Oregon, we took immediate steps to put preventive measures in place at long-term care facilities. These include restriction on visitation, in-person reviews of infection control procedures and plans for pandemic at more than 670 facilities, new prevention protocols, in which all long-term care facilities are required to report if a resident or staff member has COVID-19 or has a test pending. While Oregon is focused and has been focused on early prevention, we know that has required significant sacrifice, both for residents who live in these facilities and for their loved ones and family members. Social isolation and not being able to see your loved ones puts extreme stress on residents and their families. While we believe that our early intervention and actions help, we also know that we need to stay focused on protecting residents in these settings. As of April 14th, 24 long-term care facilities, which represent about 4% of facilities in Oregon, had current cases of COVID-19 among residents and staff. In addition, 6 adult foster homes are currently reporting COVID-19 cases, representing 1% of the total adult foster homes in Oregon. At least 32 deaths are associated with outbreaks at long-term care facilities, more than half of the statewide numbers. Our hearts are with the families, residents, and staff who have been affected by COVID-19. Today, we'd like to share with you additional actions that the state is taking to protect residents and staff of long-term care facilities and to prevent further outbreaks. We formed a multi-agency team to provide support when necessary, intervention at both long-term care facilities and other congregate settings in Oregon. We've also established the state's first dedicated COVID-19 facility. We believe that these additional steps, along with the actions we took in March, will better equip Oregon to deal with this pandemic. I'd like to invite 2 people who are leading this effort to provide more details. Jana McClellan is the Deputy Director of Child Welfare at the Department of Human Services, and Steve Allen is the Behavioral Health Director at Oregon Health Authority. First, I'd like to invite Jana up to the podium.
Thank you, Director. My name is Jana McClellan. As Fariborz mentioned, I currently sit as the co-manager of the Health and Human Services branch for the management of the incident that we're currently in. I'd like to let you all know, talk a little bit about the multi-agency support partnership that this team is working toward. It is between the Department of Human Services, the Oregon Health Authority, and local public health departments across the state. Working together, we're assessing the facilities and keeping eyes on the rising COVID-19 cases and rapidly responding to their needs. Some of the resources we have provided so far include an infection control assessment and technical assistance provided as needed across the state, building out with staffing needs to meet the temporary care and operational needs of any of our long-term care facilities. We're offering help identifying resources for personal protective equipment, or PPEs, across the state. And we're also providing assistance to ensure that residents with COVID-19 are sufficiently quarantined and developing plans in place for each time there might need an alternative placement. To that end, these alternate care facilities, as Fariborz mentioned, are in the operationalizing stage. The first one was opened yesterday, a facility in Portland, Oregon at Laurelhurst Village. It is a 47-bed operation, its own unit, standalone unit, to provide patients who have tested positive for COVID-19 and are discharged from the hospital a place to recover. This facility will open more beds for individuals with a higher level of care as needed and as we move through this pandemic. Additional contracts are underway for these alternative care facilities across the state. We hope in the next day or two to have at least another contract in place in the Portland metropolitan area, and then we'll continue building out from there. And lastly, our goal is to have capacity around the state to support the regional needs for all folks suffering from COVID-19 as they exit and live within these nursing home facilities. It's my pleasure now to turn it over to Steve Allen, our Behavioral Health Manager for the Oregon Health Authority.
Thank you, Jana. Again, my name is Steve Allen, Behavioral Health Director for the Oregon Health Authority, but also serving as co-manager for the Health and Human Services branch as we work to provide additional state supports for this outbreak. I think it's important to recognize that the state, both at the local and statewide level, is built to manage usual outbreaks. We have local public health authorities, we have counties, we have the state, all prepared to handle a typical flu season. This is not a typical flu season, but those training, the resources are in place to handle a normal outbreak. That includes training and protocols at the facility level and engagement at the local and county level. What we've done here is recognizing that the COVID virus is not a typical outbreak and it needs additional resources. And so that's what we've been working to build out, and that's what we're discussing with you today. So at the Oregon Health Association level, we provide infection control. We have epidemiologists who are prepared to consult with and who may be called in on a typical or atypical case. We perform guidance, provide information, and provide additional support. In our new COVID response, we have new challenges to attend to, ones that counties and local public health authorities and facilities can't handle alone. That's what we've been working to develop. And those include, and I think it's also important to notice that we are not working to supplant those local efforts. We're working to augment and work in partnership with the local governments and counties as we work for this resources. So these new resources we're putting in place are actually triggered by a request by the counties or local public health authorities. The tools that we can put in place, some of which are the facility capacity that Jana just talked about, new capacity that are alternate care facilities when we need to decompress a facility that is experiencing a severe outbreak and can't adequately cohort, isolate, and manage an outbreak that's in place, additional technical assistance, emergency personal protective equipment that may be needed for staff or for consultants who we may bring in to support the effort, testing that may be recommended to help manage the outbreak and inform decision-making on how we manage the outbreak at the facility, ongoing monitoring, and all through the regional coalitions and through those local partnerships. An additional capacity, which is really assisting in this effort, is as we talked about, there's lots of these facilities of various types, and not just the long-term care facilities. There are facilities that provide services for people with developmental disabilities. There are facilities that provide services for people with mental illness and substance use disorders. There's a variety of these facilities provided across the state, and what we've lacked until this point is the ability to really hone in and focus our efforts on particular facilities that have these emerging needs. New data systems that we have in place now, coupled with information that is coming up through the regions, help us now focus our efforts on those facilities that have emerging outbreaks. An additional capacity that we've recently utilized is the ability to bring in emergency medical services to physically assess in a severe outbreak individuals within a facility, and so that each person is assessed and determined whether or not they may need to be hospitalized. We engage that additional expertise and services over the weekend to transport 20 individuals to local area hospitals so that they could be further assessed and treated for their conditions. So while less than 20% of individuals with COVID positive are in long-term facilities, we now are aware that over half of the fatalities are occurring in those facilities. So that's why we're focusing our initial efforts on supporting local governments and local public health authorities in those facilities. And as we build out this capacity, we will be focusing on other facilities that may be needed. So thank you for all of your support, and we take questions at this point.
Again, Fariborz, Pakseresht, Director of Oregon Department of Human Services. We are open for questions, and I will repeat the questions so everyone can hear those.
And as a reminder, if you have a question, please either click the question mark or raise your hand. Questions. Kalaboshi. Kalaboshi, unmuting your mic now. You're self-muted. Please unmute your mic. And go ahead.
This is Kyle Aboshi with KGW Channel 8. Can you hear me okay?
Yes, we can. You self-muted again, Kyle. There you go. Go ahead.
I'm wondering what you can tell us about recent inspections at healthcare at Foster Creek, when those occurred, and what findings you discovered.
The question was, can we provide some details about recent inspections at Foster Creek? What did it result in, and what did it uncovered? There's been a lot of actions that has happened at Foster Creek. We've been in contact with the facility since late March. I will turn it over to Steve Allen to go over the details of what has happened just over the course of the past 2 weeks. And again, this is a response not just by DHS and OHA. There are many parties involved, including the local health authority. Steve will provide details.
Thank you. The multi-agency partnership was engaged by Multnomah County on Friday, April 2nd, so 2 weeks ago today, with an urgent request for assistance at the Foster Creek facility in an outbreak that was rapidly growing. On that Friday evening, we were assisted by Providence Hospital, who admitted 4 patients to that facility for further assessment. Through the weekend, both agencies, along with county assistants and local public health assistants, worked to further assess the facility, provide guidance on cohorting of staff, cohorting of residents, providing emergency personal protective equipment, and strategies around further testing. Through the course of the week, we also learned that that facility needed additional staffing, both to meet their minimum requirements for staffing, because staff had also been affected by the outbreak, but also to enhance the staffing so the facility could cohort their resident capacity and having only staff work on particular units rather than working across units. Through the course of the week, we continued to monitor the facility and the progress being made along with our county partners. We determined last Saturday, so a week from tomorrow, that it would be beneficial to bring in additional emergency management assistance to review each medical case individually and make decisions about whether additional medical assistance was needed above the ability of the facility to care for those residents. A decision was made at that point in consultation with emergency medical services to transport, I believe, 20 residents from that facility to local regional hospitals in partnership with Multnomah County, and those individuals were subsequently assessed at those hospitals. In addition, DHS brought in assessors to continue to monitor infection control measures and to assure that they were following policies and procedures that were relevant for infection control.
Okay, Camilla, you have a question, and for which presenter?
Yes, if you can hear us okay. Just kind of, Steve, going back to what you were saying, when DHS brought in those assessors to Foster Creek, what did they find as far as the infection control procedures? Were there specific details that were maybe concerning to those assessors?
So those findings led to a condition on the facility's license, and my understanding is that we're not able to share the details of that finding at this point. Is that correct?
Fedora, you have a question, and which presenter?
Steve Allen or Dr. Fariborz as well, either one. So I wanted to ask, so does DHS believe that the order and the condition signed yesterday will likely prevent the spread of infection and save lives going forward?
The question was if DHS believes that by putting the condition in place yesterday, lives will be saved as we move forward. If we did not have good reasons to believe that by putting the condition in place, we can get ahead of this situation and improve it, we would not have done it. So naturally, nothing can be guaranteed for the future, but as we stand here, we have confidence that with things being put in place, with more oversight and with a consultant oversight management firm coming into the picture, with the help of Oregon Health Authority and DHS surveyors, we will be able to turn this thing around.
Okay, and so the first cases, at least that the facility reported online, were 3 cases March 27th. By April 6th, the facility reported 4 confirmed, 1 presumptive case also online. So if these steps that, as far as I understand, you hope will turn things around, had been taken earlier, could the outbreak have been contained to any degree or lives not lost?
The question is, with the steps that have been taken, if those steps would have been taken earlier, could lives have been saved? That's a very difficult question to answer, naturally, because we are hypothesizing here. What I can share with you all is that as soon as we became aware that there is a condition and there is a situation in healthcare at Foster Creek, we began taking action. There are currently 24 facilities that have COVID positive cases in Oregon. We're working with all of them. Not all of them are in crisis. When a facility gets into a crisis mode, we step in. Again, our role is oversight. As early as March 24th, APD issued an executive order for the facility. And then on April 3rd, as Steve shared with you already, a facility support team was put in place, and Multnomah County Public Health convened the team and worked with the facility to address the issues. So I think the viewpoint where we can speak from is what we have done. I'm hesitant to get into what could have, should have been done, because it's really difficult to have a conversation like that with certainty.
Okay, so sir, if you don't mind, one more follow-up. So given the scope and given the breadth of problems identified in the inspection with the 22 bullet points of findings, why wasn't strict action, as is spelled out in the condition, why weren't those steps not only taken but ordered earlier?
The question is, why was not the order put in earlier in light of all of the deficiencies that have been identified? Fedor, what I would tell you is that, again, our action is based on the condition that is happening at the facility, and there's escalated action based on escalated condition. I think Steve outlined exactly what happened as early as the beginning days of April, when about 2 weeks ago, we became aware that the situation was escalating. And at that point, we have put a series of things in place. I can certainly go over those, but I think those things have already been communicated. And again, we don't necessarily run the facility. We put conditions in place and then have the oversight to improve those things. And if you actually look at the actions that DHS has taken, it has been escalating as the situation has gotten more intense at Foster Creek.
Okay, we have one follow-up question remaining. Camilla?
Yes, if you can hear me, this is Camilla again with Fox 12. I'm curious, since we have this document with all the conditions that was sent to us, why can't we talk through some of those bullet points? Because it seems like some of those violations were pretty basic things like hand washing or having people work between 2 different units. Can we not address any of those findings?
We had technical difficulties, our apologies. We can hear you.
Okay, perfect. Would you like me to re-ask my question?
Yes, please.
Okay. The question was, we received the documentation that was sent to us regarding the safety oversight quality here at Foster Creek, and it seemed like some of the observations within the violation of infection control was simple things like hand washing or having staff members working across units. Can we not talk about what some of those observations are and the implications of them?
The question again was the document that has been released points out specific deficiencies in the facility, including some simple things such as hand washing. Can we or why cannot we talk through those things? Camilla, my answer to that question is the document's out there. The bullet points are out there. At this point, I much rather spend our time talking about other questions because this is a public document. You can all see it. In short, I would tell you that both DHS and OHA provided guidance to the facility in earlier visits about what needs to take place. And then in subsequent visits, when we observed that those things were not being adhered to, the current order was issued as a result of that. And what you see in the bullet point basically describes that.
Okay, we have some online questions.
Just one more thing that I'm going to allow Steve Allen to add to that.
Thank you, Director. And I think that's exactly right. Not only did OHA provide technical guidance on appropriate infection control measures, but DHS staff assessors were also physically present in the facility on multiple days. And when we discovered that the facility was not adhering to those infection control guidance, we believe that the residents at that facility were being placed at an unacceptable level of risk, which is why we triggered the EMS intervention to have all residents assessed and with up to 20 subsequently transferred to hospitals. So we took swift action when we discovered that those prevention measures weren't being followed as we did. It's the condition on the license was not intended to be the primary action. The action we took was to decisively engage with the facility and make changes to management structure and to intervene medically when we believed that those residents were no longer safe.
Okay, Rachel Monahan, you have some questions?
Yes. First is the question of how many residents were in this facility when this started, I guess around March 27th?
The question was how many residents were in healthcare at Foster Creek when this thing started. That number is 96.
Okay. And then can you, more broadly, can you answer the question of how many deaths have been reported by long-term care facilities or adult foster homes at this point versus how many have officially been have been documented as COVID-19 deaths at this point? Because now we're, there's a different number today for Foster Creek.
The question was, can we talk about how many total deaths have been reported in long-term care facilities? There is a different number that has been reported today at Foster Creek. The numbers that I have in front of me, I'll give you the total number as of 2 days ago, which is April 14th. So 32 total deaths in long-term care facilities. However, that document listed 9 deaths at Foster Creek. Today, I believe the number is 14. So
Right.
I will then need to add 5 to that 32 for a total of 37 across Oregon in all long-term care facilities.
Okay, my understanding of what was written in the press release today was that there was a difference in definition. Is that not the case? Is it not a difference between the number reported by the facility and actually documented? What's the difference between 2 days ago and today in terms of Foster Creek's deaths?
The question is, what's the difference between the numbers 2 days ago and today? The timing of when the death occurs and when it is reported, I'm not privy to that. I'm going to turn it over to Steve to speak through how these numbers are reported and why there may be a difference. But as of today, that number is 14.
Yeah, thank you, Director. So the Public Health Authority does gather the death information and tracks whether or not that death may be or may not be related to COVID-19. I understand that the facility was reporting separate numbers, but the official number through the public health is 14. 13 of those are confirmed COVID positive. 1 is presumed COVID positive.
So that raises a new question. Are the numbers we're getting from OHA for all deaths both presumed COVID positive and confirmed COVID positive deaths, or are most of those confirmed positives?
The question is if the numbers reported by OHA is all COVID positive or includes presumed COVID positive. We'll get the answer to that question to you. We don't have that information in the room right now.
Okay, and then just I have a few questions on testing. Can you explain what the criteria right now that's being used to test people in long-term care facilities or adult foster homes? Do the facilities have enough tests? And what's the turnaround time for getting test results?
I'll turn it over to Steve to answer that question.
So I'll just start out by saying I'm not the testing expert, and it would be good to have a follow-up with our epidemiologist for this question. But a couple of things. One is that test strategy and the testing availability is emerging. So tests are increasingly available, and the time for the results is decreasing over time. The strategies, though, for testing a long-term care facility need to be directed by the professionals who are working in this area to decide when or when not testing is appropriate. And just as an example, in the case of Foster Creek, what we determined is that the process of testing individuals who the testers do not necessarily know their status, whether they're symptomatic or not, they may still have the illness, requires a tremendous amount of personal protective equipment to help protect safety and not to increase the chance of infection across units. And so a decision with scarce personal protective equipment and scarce testing needs to be made with professional guidance. And in this case, our epidemiologists and our infection preventionists were critically involved at various moments along the way in deciding how PPE was used and how testing was used to inform decision making.
So can I ask you a follow-up? So then is the problem, the limiting factor PPE at these facilities? Is that a key weakness in responding to an outbreak right now?
It can be. In this particular case, we made emergency personal protective equipment available within 12 hours of the initial request, and we ensured that PPE was available both to the EMS folks and to the facility staff throughout this incident.
So then they could test at Foster Creek if they needed to?
Yes,
Okay.
testing was possible, but that discussion was held between the folks on the ground doing the assessments and our epidemiologists about setting a process in place that protected the needs of the residents at the facility while ensuring that the testing was used wisely.
So thank you for your questions. If you have additional questions, I encourage you to send them to DHS Communications. I do want to close with a couple of thoughts about Foster Creek, given that the majority of our conversation today has been about this facility. As I said before, all of us, you and us collectively, are concerned about the residents, about the staff, about the families. I just want to remind all of us that this is a facility that's still open. We have people who are living there. We have dedicated staff working there. Everyone is focused on taking care of the staff and the residents, and we do not want to see one more fatality, though we don't really control the future. My hope is that what has happened in Foster Creek does not bring us to a point that not want to support the staff, support the administration to move this thing forward. There is only one way for us to work out of this pandemic, and that's together. That includes the media. Thank you for your time today.